I'm Sheila Redfern and I'm Consultant Clinical Psychologist at Anna Freud National Centre for Children and Families. I'm Head of Clinical Services for Maltreatment and Trauma, and my specialist interest is in developing services for looked after children. Particularly this group of children are more vulnerable than the average child to mental health difficulties and also to having additional learning needs. So they're of particular importance to thinking about how to work with this group of children in schools. There are approximately 70,000 children looked after in the UK at the moment, and because that group of children have a much higher than average likelihood of having mental health difficulties as well as other additional learning needs, it's really a public health issue for us to try and address those needs, both in terms of developing new interventions for working with that group of children clinically, but also in terms of increasing awareness for teachers who are working with those children on a day-to-day basis. In terms of how they are in the school, what I really want teachers to be aware of is that there might be hidden needs that those children have. So lots of children looked after will have had some kind of early relational trauma, which can mean that they have difficulty with their friendships. They might have difficulties in how they relate to their teachers, and those might be obvious in terms of behavioural difficulties, or they might be hidden, and there might be latent vulnerabilities that we don't see in that group of children. That it's really helpful if teachers are aware that children who are in the care system might not always manifest the kind of difficulties that they're actually feeling inside. So it's having some kind of sensitivity to the kind of vulnerabilities that are there, but at the same time not assuming that because they are looked after that these children are automatically going to have experienced trauma. And for the young person themselves, it's really key that they're not seen as being either special or different. So it's a real balancing act that a teacher's got to achieve between being sensitive to the fact that they may have additional difficulties, that they're more likely to have additional difficulties, but not assuming that all children in care are the same. And I guess that relates to something around stigma, that lots of young people in care that I've worked with and that talk to us about the kind of help that they want to have, they don't want to be seen as part of one generic group. They're all individual people and they're not necessarily all going to have the same kind of needs. Another issue for teachers to be aware of is that all children will have a LAC review, and that the teacher will be part of that, and so these children have lots of professional meetings that are held around them that other children, their peers, won't have, and that marks them out as different. And those meetings, they might get called out of school to go to them, they might have to go and meet their social worker quite frequently. And again, teachers need to be sensitive to the fact that that's very stigmatising for a young person, particularly in a school where they're seen by their peers. You know, if a child goes off to a meeting, their peers want to know, where are you going? Did you have an appointment at the dentist? And the child doesn't want to necessarily say, I had an appointment with my social worker. So being really, really aware of how sensitive all children are to not wanting to feel different. For the looked after child that may, say, be picked up by a taxi as opposed to being collected by a parent, these are kind of differences that they have to deal with on a day-to-day basis. And so teachers would be really wise to kind of be sensitive to how that feels for the child and to make those differences not as kind of least marked as possible, so that they're not so obvious to others. Another area that's really important is the kind of things that other children might think of as really big, sort of positive, happy celebrations might not necessarily be for a looked after child. So lots of schools will celebrate Mother's Day, for example. They have a Mother's Day assembly, or they might make cards for Father's Day, or there's a school show around Christmas and it's got lots of noise and lots of activity around it. If a child's had a really difficult early life, those events might be really sad moments for them. They might be overly stimulating for them as well. So something about being sensitive again to the fact that things that other children and schools might feel are really positive events might actually be kind of quite difficult for a child to get through. Many children who are looked after will have several placements throughout their life. They might move from one foster home to another, and so there might not be one constant person in their life that actually carries their whole history other than the teacher, because often children will remain in the same school whilst changing their foster carer. So I'd like teachers to feel empowered to be able to have a significant input into, say, the LAC review that will happen annually for a child who's in care. And if they have an input into that review, then they might be able to help there be some kind of continuity for that child over time, which is often missed if the child's moving from one home to another. And the child that may be their most trusted relationship with their teacher if they've been in several placements. So that's one main reason why the teacher's role is really important. And if teachers can feel they can liaise with the social worker for that child and actually make a contribution to the review, then they can hold some of that continuity in mind. And that consistency is so important for children who are in care, because they won't necessarily have experienced that anywhere else.